A guide to paying for care when going into or you are already living in a residential or nursing care home. This video explains about paying for care when you are going into or are already living in a residential or nursing care home. There is a separate video on paying for care when you are getting care and support at home and you are not living in a residential or nursing care home. Unlike services provided by the NHS, most adult social care services are not free of charge. This means that when the council helps you to arrange your care and support services, you will have a financial assessment to work out how much you have to pay towards the cost of your services. This is worked out using your income and any capital or savings that you have. We recommend that you get independent financial advice. Assessments. You must have completed a care and support assessment before having a financial assessment. This care and support assessment determines if you are eligible for support from the council. Both the care and support assessment and financial assessments can be completed securely online. You can get an estimate of the financial contribution you may have to make by using our online calculator. This is an estimate based on the information you enter, and the actual amount you are asked to pay may be different after a full financial assessment. The information we ask for on the financial assessment form and the supporting information you supply helps us to work out how much, if anything, you will have to pay towards your care and support services. If you are not able to fill in the online form and do not have anyone to help you to do this, we should be able to give you some help over the phone, or in exceptional circumstances can send you a paper version of the form to fill in. You may decide not to give us any information about your finances, but we will assume that you have savings of over £23,250 and will treat you as a full cost payer. You will be charged what it costs the council to buy the services on your behalf. Deprivation of assets. If you have given away, gifted, transferred ownership to another person or spent these, and you did this knowing that this could reduce or remove any future care fees, then there are circumstances in which we can treat you as though you still have the capital or assets. This is known as deprivation of assets. Should the council consider that this has happened, then we will treat the value of those capital assets as though you still own them when we complete your financial assessment. Paying towards the cost of your care and support services when you are living in a residential or nursing care home. This is known as residential care and covers periods when you are staying temporarily in or living in a residential or nursing care home. Once your financial assessment is complete, we will send you a letter letting you know how much you will need to pay, how this has been worked out, and how and when any charges will be collected. We normally expect you to pay your charge by direct debit if your care and support services are arranged on your behalf. Unlike non-residential care services, if at any time the value of your savings and capital is over £23,250, you will have to arrange to pay the care home yourself. This is known as self-funding, and we have a separate video on what that means for you if you are in this position. We recommend you seek independent financial advice to help you plan to pay privately for care in a care home. If you notify us that the value of your savings and capital has fallen below £23,250, we will look at this again. This figure may include the value of any property that you own, but there are exceptions. You can ask us to start our financial assessment process when your savings get to £30,000 or lower, to allow time for your care assessment to be completed. If your stay in a residential or nursing care home is only temporary, and for a short period, for instance because the person who normally cares for you at home is ill or on holiday, you will still need to have a financial assessment to see how much you will have to pay towards the cost of the care. In this case, the value of your home will be ignored unless it is decided that you will be remaining in the care home permanently. What happens if you own a property? The value of your home that you own or part own and lived in before moving to the care home is ignored in the following circumstances. If you have a child aged under 18 years who is living there, If your spouse, civil partner or long-term partner is still living there and you lived there together before you moved into the care home. If you have a close relative aged 60 or over who is incapacitated who is living there and they did not move in to get the value of the property ignored. If none of the above apply, the value of your property is ignored for the first 12 weeks that you live in the care home, or for the 12 weeks following the end of your NHS funding after a hospital discharge if you lived there before moving into the care home, and your other savings and capital are under £23,250. This is known as a 12-week property disregard and is there to give you time to plan how you will fund your long-term care. Deferred payments. One of the options that is available to you is to apply to us for a loan in the form of a deferred payment agreement. A deferred payment agreement allows you to use the value of your home to pay for care in a residential or nursing care home or extra care housing. It may be an option for you if you either have capital and savings below £23,250 and you own a property but you cannot afford to pay the full weekly charge, or you do not want to sell your home and most of your capital is tied up in your home. A deferred payment agreement would be considered if you have recently moved into a residential or nursing care home, or you are planning to do so, or where you still own a property, are in a care home and have been self-funding, but your savings have fallen below £23,250. We recommend that you seek independent financial advice. The Money Service Advice can help you choose a financial advisor. Your property must be registered with the Land Registry, have sufficient empty property insurance if the property is going to be empty, and you must have the mental capacity to understand and enter into the agreement. If you do not have capacity, then a legally appointed person can set up a deferred payment agreement on your behalf. What about other income? Some income that you may have is not considered in the financial assessment for residential and nursing care. This includes income from war pensions, including War Widows Pension and War Disablement Pension, 50% of any occupational pension that you receive if you are one of a couple, earnings from employment or self-employment, the mobility component of Disability Living Allowance, DLA, or Personal Independence Payment, PIP, attendance allowance, DLA care component, and PIP daily living component if you are only staying in the care home temporarily. These stop after you have lived there for 4 weeks or sooner if you have been in hospital recently. Occasionally, if there has been a long delay in the financial assessment process, we will send you an invoice for your first payment. Top-ups. If you need to go into a care home and you are entitled to support from the council, then the council will pay a preset rate for a place in a care home. If you or your relatives wish to go into a more expensive care home, then you have the option to pay the difference between what the council contributes and the cost of the place where you wish to go. This difference is known as a top-up. You can pay this yourself, known as a first-party top-up, or you can get a relative or trusted person to pay the difference, and this is known as a third-party top-up. The council will conduct an affordability check to make sure that the person or persons making the third-party payments can afford to pay it. This assessment considers income, savings, and other financial factors. In either case, an agreement is signed with the council which forms a financial contract between the payor and the council. You can use your own resources to pay a top-up during the 12-week property disregard period, or if you receive funding under Section 117 of the Mental Health Act. There is a separate video on this topic.